When I first heard Thomas Edison's words that the doctor of the future will give no medicine, but will interest in patients in the care of the human frame, in diet, in cause and prevention of disease, it sounded like a prophecy, like something from the future. But given that I was still at medical school trying to figure out my future, it resonated too much with me. And for years in medicine, I did what we are trained to do, what had to be done. Diagnose the problem, prescribe the right treatment, give proper advice to the patient, and then move on to the next one. But then I noticed something, sort of like a pattern. People weren't really healing. They were just coping better. That same person would come back a few months later and say, last time you gave me medicine, I was better in days. But the problem has come back again. The same issue has come back again. But I've always been like this. I always have this problem. I've always had ulcers. These headaches don't really go away. I've always had them. So you realize that some people have normalized sickness and they wear it. They are so familiar with it. They wear it like a badge. And they always go to pharmacies for those quick fixes and eat it. And they take those pills for comfort. Literally part of their diet. Now, but what if I told you that health was never meant to be left to chance? There's a design, a structure, a rhythm to how the human body thrives. And once you learn to live in harmony with that design, disease becomes a simple interruption and not a lifestyle. That is what I call health by design. Because healing shouldn't be random. It should be intentional. What you eat, how you move, when you rest, how and what you think about. None of that is secondary. That is the treatment. It's not about giving up medicine. It's about giving medicine a lot less work to do. So I once, one of those days, I told someone, if you only learn how your body works and how to keep it, how to maintain it, how to stay healthy, you won't have to visit the clinic as often. They just laugh because they're so used to what they were dealing with. And yet it could be reversed. But that is the goal. Not dependency on medications, but design. Not endless medication, but mastering your own health. Because health isn't just physical, it's personal, deeply personal. And it begins the moment you start taking responsibility for what your body is trying to tell you. When you begin to rest intentionally, eat consciously, move deliberately, and think kindly, that is when you stop fighting disease and start living by design. Now in 1 Corinthians 6:19, it says that your body is the temple of the Holy Spirit. Your body is the temple of the Holy Spirit. Now that means that health is sacred stewardship. It's not about vanity. It's about value. Your body is not a rental. It's God's living space on earth. Every choice you make, from what you eat, what you think about, is either repairing or ruining that temple. But then there's this group of people who say, I don't have time for that stuff. I don't have time to exercise. I don't have time to cook. I don't have time for any of that. But then I always tell those people, do you have time to be sick? Do you have time to be sick? Do you really have time to be sick? Because whether you plan it or not, your body is going to demand your attention. The only question is when. Romans 12:1 says, take your everyday ordinary life. You're eating, sleeping, going to work, walking around life, and offer it to God as a living sacrifice. That is the message value. Take your everyday ordinary life. You're eating, you're sleeping, you're going to work, and you're walking around life, and offer it to God as a living sacrifice. That is health by design. Taking the ordinary parts of your life and turning them into instruments of healing. Because health isn't something that happens to you. It's not random. It's something that happens through you. It's something that happens through you. Because if you practice what you know about how to live well, your health will stop being by chance, but by design. So for most of us, it is time. If you didn't know, start. Start now. It is never too late to start. And I take and invest my time in teaching people how to build these lives and implement these simple techniques into their lives practically, one habit at a time. And it can fit in whatever schedule it is personalized just for you. It is simple, it is preventive and holistic. So if you are interested in getting to know how this can really fit in your day-to-day life, how you can apply what you already know about healthy living, exercise, nutrition, and fit it in your life without having to go and complete overhaul, because most of us can't, then click the link in the description, find me on WhatsApp, and we can create that personalized plan. See you on the next one.